Last year, more than 1,900 adults and 1,300 children were homeless or at risk of homelessness in our communities. Anyone can become homeless: families, single parents, and individuals. They all ask, "Where can I get help?" In the past, help was a confusing maze of phone calls, appointments, and referrals. Now we have a way to access our community's housing services through a single phone call: coordinated entry. How does coordinated entry work? A person who is homeless or at risk of homelessness calls United Way's 211 helpline and is immediately connected to the coordinated entry case management team. Then the coordinated entry case manager conducts triage to see if emergency shelter is needed. The case manager then conducts assessments to determine the household's vulnerability, eligibility for housing programs, and prioritization level. The assessment uses standardized tools and common screening questions to fairly prioritize placement based on vulnerability and need. If the household is prioritized for services and a program opening is available, they receive a referral to an agency to complete the application for housing services. Referrals are made for the most appropriate housing assistance, including homelessness prevention, emergency shelter, permanent supportive housing, or transitional housing. If the household is eligible for services, but none are available, they're put on a community waiting list prioritized by their vulnerability and assessment scores. While on the waiting list, households receive case management services to help them maintain safe sleep and shelter arrangements and prepare for the housing service application. All households, including those not eligible for housing services, work with a coordinated entry case manager to develop a housing stability plan. The housing stability plan could include utility and rent assistance, temporary shelter, food pantries, mainstream assistance programs, and personal resources and connections. Through coordinated entry, families, single parents, and individuals are on the path to housing stability. How can you help? We need people in the community like first responders, hospital staff, teachers and counselors, and church staff and volunteers to share information about coordinated entry. When you encounter someone who is homeless or at risk of becoming homeless, simply direct them to the 211 helpline or give them a coordinated entry card. The coordinated entry team will then help that person or family find the assistance they need. For more information about coordinated entry, visit us at www.communitycouncilstc.org.